Hi, my name is Dr. Antelak. I'm at thegentlendentist.com in Shelby Township, Michigan. My phone number is 586-247-3500. And one thing that we check for during every single examination I do is for oral cancer. Oral cancer develops on the very back of the, usually most common area is the very back of the tongue, underneath the tongue. Oral cancer is more prevalent on people who are smokers, but the most prevalent are people who have drinking habits, and there are smokers also. So people with that type of profile are at a much higher risk for developing oral cancer. Oral cancer, unfortunately, it's a very prevalent disease, and unfortunately, we normally will see it at a later stage of development, so that the 5-year survival rate is quite low. What we do is if we can, when we look to see if we can diagnose it or determine there's cancer, we'll do something called a brush biopsy. You know, in the soft tissues, we want to see if things are, the color changes are an important aspect of what cancer would look like. But to be certain, we'll take what's called a brush biopsy. It's sterile, and this is a little brush that we use. And on this brush, we'll actually take someone's mouth and we'll scrape the soft tissue off of that area. So we want to get down to some deeper cells where that lesion might look like in the tongue. And then what we do is that we'll take that and put that on a microscopic slide. Here, we have some things to put on it. And then we'll just go ahead and rub that on there like that. And then we put a cover slip over it, and we send it to a lab. That laboratory will go ahead and do they'll do a screening of that and give us an idea if there's things that look normal or if there's something that looks abnormal. Then we go on to the next level if it is something. So, you know, unfortunately, oral cancers, like any cancer, very, very rarely do you even know what's going on in your mouth or in your body until it's too late. So what's really important is early diagnosis. Early diagnosis. That means getting into the dentist. Having your, you know, when we check the lymph nodes in the neck, we check the lymph nodes underneath the chin here. We look at the lips, we look at the soft tissues near the tongue. All these areas are indicators of health and whether there's something that's going on. So it's really important to do that, you know, especially if you do have a habit of smoking, and if you're a drinker, you're at a much higher risk. So do something as a favor to your loved ones. Get yourself checked out, and then if something is necessary, we do use a brush biopsy like this to do the preliminary exam. So if there's any questions you have, we can be reached at 586-247-3500. Thank you.